Hi, my name is Mary Mannix and I'm CEO of Augusta Health, and I'd like to share with you a situational overview of the seriousness of COVID-19 in our local community. Our current situation in the community and here at Augusta Health is the most serious it has ever been since the beginning of the pandemic. Our team members are being spread very thin, too thin in my opinion. It's very difficult when 3 people in their 20s die all within the same week. I can't overemphasize the seriousness of this situation and the impact it is having on the caregivers in this community. I'd like to begin by talking about a concept called the testing positivity rate. This is a very important public indicator of the amount of COVID that's in our community. Just to give you a benchmark about what that number might mean, back in May, when we were in a different state, the Johns Hopkins said no community should be opening back up if they have a testing positivity rate of 5% or greater. And in fact, the World Health Organization said a community should be 5% or below 5% for 2 consecutive weeks before a community were to open back up. Our testing positivity rate here in Stanton, Augusta County, and Waynesboro is 31%. That is exceptionally high. That means that there is a very large amount of COVID-19 in our community, and it is very infectious. At Augusta Health, we're at capacity. What that means is that we have all of our ICU beds full. We have patients that are holding in the emergency department. We have patients that are in every nook and cranny of our hospital. So for example, we have critical care patients in our recovery room where we have nurses and technology to care for them. We're close to running out of space. What this means is that if you need hospitalization, we'll do everything we can to care for you. But there is a chance that you might need to be transferred or moved to another healthcare system somewhere else in the Commonwealth of Virginia. What are we doing? We have opened up a second ICU to care for critical care patients. As I've mentioned before, we've opened up every nook and cranny of our hospital where we can put beds and we can put people to care for our community. We have a second emergency department in a tent located outside of our emergency department building. We have a morgue truck to care for the increase of deceased people. We've asked for additional resources from the state and the federal government to come and help us care for our community. What are the consequences for us? Our team members are stretched very thin and they need the help of the community. They need your help. We're running low on resources, and what we need is for the unvaccinated people in our community to get vaccinated as soon as possible. We need to avoid any unnecessary infections of COVID-19. This will provide relief to our health system. We're also asking you to please mask. Please don't expose yourself to large crowds in public places. In fact, stay home until our testing positivity rate and the prevalence of COVID-19 in our community decreases. What can you as the community do to help us here? Again, please get vaccinated. It's never been easier. Get your shot to protect people who can't get theirs, like children that are under 12. Talk to your loved ones about getting their vaccination. Mask, distance, hand hygiene, washing your hands. The vaccine provides the greatest protection from serious illness. But even with being fully vaccinated, this Delta virus is so serious that you can still experience a breakthrough infection. In fact, we are seeing people come to our hospital that are fully vaccinated. They tend to be older, patients that are over 65. They tend to have other conditions like asthma, or they might be smokers, or perhaps there is a problem with being overweight. Other conditions like that. These are complicating factors. These are factors that we can all avoid, these types of hospitalizations, if we can get a higher vaccination rate in this community. So whether you're vaccinated or not, you might still fall into some of these risk categories such as age, being overweight, smoking, asthma. These conditions put you at greater risk. So please protect yourself by staying home as much as possible, masking, not going into large public areas where there's a lot of crowding, and please get vaccinated. We're doing our part. We love our community. We pride ourselves on taking care of our community. We're asking you to please do your part. Thank you.